Welcome to the Wise Solutions Bloodborne Pathogen Safety Training. My name is Billy Campbell. I am the Director of Safety. Here is your training. Lesson objectives. Define bloodborne pathogens. Identify workers who are at risk of exposure to bloodborne pathogens. Identify key aspects of a bloodborne pathogen exposure control plan. Describe methods for controlling exposure to bloodborne pathogens. Describe steps to take when exposed to a bloodborne pathogen. Over the years, there have been outbreaks of diseases around the world. Three examples of outbreaks that have affected the U.S. include the 1981 outbreak of HIV, the 2014 outbreak of Ebola, and, most recently, the 2016 outbreak of the Zika virus. All three are examples of diseases that can spread through contact with infected blood or other bodily fluids. The CDC estimates that 5.6 million workers in the healthcare industry and related occupations are at risk of occupational exposure to bloodborne pathogens, including human immune deficiency virus, HIV, hepatitis B virus, hepatitis C virus, and others. All occupational exposure to blood or other potentially infectious materials places workers at risk for infection from bloodborne pathogens. Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and human immune deficiency virus. Needle sticks and other sharps-related injuries may expose workers to bloodborne pathogens. Workers in many occupations, including first responders, housekeeping personnel in some industries, nurses, and other healthcare personnel, all may be at risk for exposure to bloodborne pathogens. Hepatitis B virus causes serious liver disease, which can become a chronic condition that causes permanent scarring of liver, leading to liver failure or liver cancer. Estimated 2,000 to 4,000 deaths per year in U.S. Symptoms: fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, joint pain, jaundice. Hepatitis B is much more transmissible than HIV. Risk of infection from single needle stick is 6 to 30%. 50% of infected people are unaware that they have hepatitis B. Hepatitis B can survive for at least 1 week in dried blood on environmental surfaces or contaminated needles and instruments. The risk of healthcare workers being exposed to HIV on the job is very low, especially if they use protective practices and personal protective equipment to prevent HIV and other bloodborne infections. For healthcare workers on the job, the main risk of HIV transmission is from being stuck with an HIV contaminated needle or other sharp object. However, even this risk is small. Scientists estimate that the risk of HIV infection from being stuck with a needle used on an HIV infected person is less than 1%. Hepatitis C virus causes chronic illness, attacks the liver, and leads to inflammation. Chronic infection develops in 75 to 85% of patients, with 70% developing active liver disease, can result in long-term health problems, even death. Symptoms: fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, joint pain, jaundice. Approximately 3.2 million people infected in U.S. Most have no symptoms and don't know they are infected until decades later when liver damage shows up in routine tests. Human immune deficiency virus causes acquired immune deficiency syndrome, AIDS, attacks the immune system cells, weakening and eventually destroying the immune system, and thus leaving the body at higher risk of developing more serious conditions, such as pneumonia or cancer. Nearly 7,000 people died from HIV/AIDS in U.S. in 2013. Estimated that more than 1.1 million people are living with HIV. Close to 1 in 5 are unaware they are infected. Once infected, human body cannot get rid of the HIV completely, infected for life. Some people experience flu-like symptoms: fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, or mouth ulcers. 2 to 4 weeks after infection, while others may not feel sick. HIV does not survive long and cannot reproduce outside a human host. Other bloodborne diseases caused by viruses or bacteria circulate in blood for prolonged periods during at least some phases and, therefore, capable of being transmitted through blood or other potentially infectious materials. Most are rare in the U.S. This is a list of other bloodborne diseases caused by viruses or bacteria. These circulate in blood for prolonged periods during at least some phases and therefore capable of being transmitted through blood or other potentially infectious materials. Most are rare in the U.S. Risk of exposure, contamination sources, blood, other potentially infectious materials. See list. Spread of bloodborne pathogens, primarily through direct contact. Infected blood or body fluid, mucus, from one person is transferred directly to another person. Indirect contact. A person touches object that contains the blood body fluid of an infected person. Respiratory transmission. Person inhales respiratory droplets from an infected person through cough or sneeze. Vector-borne transmission. Person's skin is penetrated by a bite or other means from an organism carrying the disease, mosquitoes, ticks, etc. Examples of modes of transmission: contact with another person's blood or body fluid that may contain blood, accidental injury by contaminated sharps, needles, contact with open cuts, nicks, and abrasions, contact with mucous membranes in eyes, mouth, nose, and ears, industrial accident, administering first aid, post-accident cleanup, janitorial or maintenance work. In most work situations, transmission is most likely to occur because of accidental puncture from contaminated needles, broken glass, or other shards, contact between broken or damaged skin and infected body fluids, or contact between mucous membranes and infected body fluids. For example, if someone infected with hepatitis B cut their finger on a piece of glass and then you cut yourself on the now infected piece of glass, it is possible that you could contract the disease. Anytime there is blood-to-blood contact with infected blood or body fluids, there is a slight potential for transmission. Unbroken skin forms an impervious barrier against bloodborne pathogens. However, infected blood can enter your system through open sores, cuts, abrasions, acne, any sort of damaged or broken skin, such as sunburn or blisters. Bloodborne pathogens may also be transmitted through the mucous membranes of the eyes, nose, and mouth. For example, a splash of contaminated blood to your eye, nose, or mouth could result in transmission. Establish an exposure control plan. Number 1, written plan to eliminate or minimize occupational exposures. Number 2, review and update the plan, at least annually, whenever new or modified task procedures affect occupational exposure, new revised employee positions with occupational exposure. Bloodborne Pathogen Standard 29 CFR 1910-1030 D1 requires employees to observe universal precautions to prevent contact with blood or other potentially infectious materials. Under circumstances in which differentiation between body fluid types is difficult or impossible, all body fluids shall be considered potentially infectious materials. Treat all blood and other potentially infectious materials with appropriate precautions such as use gloves, masks, and gowns if blood or other potentially infectious material exposure is anticipated. Use engineering and work practice controls to limit exposure. 1996, the term universal precautions was replaced with the term standard precautions. What is the difference? Universal precautions. This is the practice of avoiding contact with bodily fluids by means of the wearing of non-porous articles such as gloves, goggles, and face shields. The practice was introduced in 1985 to 88. The Center for Disease Control defined standard precautions as a set of precautions designed to prevent transmission of HIV, hepatitis B virus, and other bloodborne pathogens when providing first aid or health care. Under standard precautions, blood and certain body fluids of all patients are considered potentially infectious for HIV, hepatitis B, and other bloodborne pathogens. Some general PPE guidelines include, but not limited to: wear gloves when handling chemicals and/or body fluids. Wear safety shoes, boots, covers if hazardous substance is likely to splash. Wear an apron, gown, coveralls if hazardous substance is likely to splash. Use a respirator when hazardous substance is airborne, such as tuberculosis. Wear hearing protection for loud noises, such as from equipment. Remove PPE carefully to avoid contaminating yourself. Dispose of PPE in designated containers before leaving the area. To ensure the greatest possible protection for employees in the workplace, the cooperative efforts of both employers and employees will help in establishing and maintaining a safe and healthful work environment. In general, employers are responsible for performing a hazard assessment of the workplace to identify and control physical and health hazards, identifying and providing appropriate PPE for employees, training employees in the use and care of the PPE, maintaining PPE, including replacing worn or damaged PPE, periodically reviewing, updating, and evaluating the effectiveness of the PPE program. When engineering, work practice, and administrative controls are not feasible or do not provide sufficient protection, employers must provide personal protective equipment to their workers and ensure its proper use. Employers are also required to train each worker required to use personal protective equipment to know when it is necessary, what kind is necessary, how to properly put it on, adjust, wear, and take it off, the limitations of the equipment, proper care, maintenance, useful life, and disposal of the equipment. To ensure the greatest possible protection for employees in the workplace, the cooperative efforts of both employers and employees will help in establishing and maintaining a safe and healthful work environment. In general, employees are responsible for properly wear PPE, attend training sessions on PPE, care for, clean, and maintain PPE, and inform a supervisor of the need to repair or replace PPE. All equipment, environmental, and working surfaces shall be cleaned and decontaminated after contact with blood or other potentially infectious materials. Some equipment, if grossly contaminated, must be cleaned with a soap and water solution prior to decontamination, as some antimicrobial products will not work in the presence of blood, which interferes with the sterilizing process. Protective coverings such as plastic wrap or aluminum foil shall be removed and replaced as soon as possible. When they become overtly contaminated or at the end of a work shift, if they may have become contaminated during the shift. All bins, pails, cans, and similar receptacles intended for reuse which have a reasonable likelihood for becoming contaminated with blood or other potentially infectious materials shall be inspected and decontaminated on a regular scheduled basis and cleaned and decontaminated immediately or as soon as feasible upon visible contamination. Broken glassware which may be contaminated must not be picked up directly with hands. Use mechanical means, such as use a brush and dustpan, tongs, or forceps. Cleanup and decontamination. Wear protective gloves. Use appropriate disinfectant. Clean and disinfect contaminated equipment and work surfaces. Thoroughly wash up immediately after exposure. Properly dispose of contaminated PPE, towels, rags, etc. Regulated waste disposal. Dispose of regulated waste in closable, leak-proof, red or biohazard labeled bags or containers. Dispose of contaminated sharps in closable, puncture-resistant, leak-proof, red or biohazard labeled containers. Contaminated laundry means laundry which has been soiled with blood or other potentially infectious materials or may contain sharps. Contaminated laundry shall be handled as little as possible with a minimum of agitation. Contaminated laundry shall be bagged or containerized at the location where it was used and shall not be sorted or rinsed in the location of use. Other requirements include contaminated laundry shall be placed and transported in bags or containers labeled or color coded in accordance with paragraph G1I of the standard. When a facility utilizes universal standard precautions in the handling of all soiled laundry, alternative labeling or color coding is sufficient if it permits all employees to recognize the containers as requiring compliance with universal standard precautions. Whenever contaminated laundry is wet and presents a reasonable likelihood of soak through or leakage from the bag or container, the laundry shall be placed and transported in bags or containers which prevent soak through and/or leakage of fluids to the exterior. The employer shall ensure that employees who have contact with contaminated laundry wear protective clothes and other appropriate personal protective equipment. When a facility ships contaminated laundry off-site to a second facility which does not utilize universal precautions in handling of all laundry, the facility generating the contaminated laundry must place such laundry in bags or containers which are labeled or color-coded in accordance with paragraph G1I of the standard. Employees are not permitted to take their protective equipment home and launder it. It is the responsibility of the employer to provide, launder, clean, repair, replace, and dispose of personal protective equipment. Training. Who? All employees with occupational exposure to blood or other potentially infectious materials. Employees who are trained in first aid and CPR. No cost during work hours. When? Initial assignment, annually, or with new modified tasks. The hepatitis B vaccination series must be made available to all employees who have occupational exposure. The employer does not have to make the hepatitis B vaccination available to employees who have previously received the vaccination series, who are already immune as their antibody tests reveal, or for whom receiving the vaccine is contraindicated for medical reasons. The hepatitis B vaccination must be made available within 10 working days of initial assignment after appropriate training has been completed. All medical evaluations and procedures, including the hepatitis B vaccine and vaccination series, are to be provided according to the current recommendations of the U.S. Public Health Service. If an employee declines the hepatitis B vaccination, the employer must ensure that the employee signs a hepatitis B vaccine declination. The declination form is found in Appendix A of the standard. Employees have the right to refuse the hepatitis B vaccine and/or any post-exposure evaluation and follow-up. Note, however, that the employee needs to be properly informed of the benefits of the vaccination and post-exposure evaluation through training. The employee also has the right to decide to take the vaccination at a later date if he or she so chooses. The employer must make the vaccination available at that time. The responsibility lies with the employer to make the hepatitis B vaccine and vaccination, including post-exposure evaluation and follow-up, available at no cost to the employees. At the present time, there are no vaccinations available for hepatitis C and HIV. An exposure incident is a specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials as defined in the standard that results from the performance of workers' duties. If exposed to blood or other potential infectious materials, wash needle sticks and cuts with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate eyes with clean water, saline, or sterile irrigants. No scientific evidence shows that using antiseptics or squeezing the wound will reduce the risk of transmission of a bloodborne pathogen. Using a caustic agent such as bleach is not recommended. Report the exposure to the persons responsible for managing exposures. Prompt reporting is essential because, in some cases, post-exposure treatment may be recommended and it should be started as soon as possible. Discuss the possible risks of acquiring hepatitis B, hepatitis C, and HIV and the need for post-exposure treatment with the provider managing your exposure. You should have already received hepatitis B vaccine, which is extremely safe and effective in preventing hepatitis B infection. If the exposure is a result of a needle stick or cut, encourage bleeding and wash immediately with soap and water. The employee must immediately report the exposure incident to the supervisor. Time is of the essence. Results can often be improved by prompt action. The supervisor will immediately refer the potentially exposed individual to the appropriate healthcare professional for post exposure and evaluation, who in turn will evaluate and treat the individual based on guidelines set forth in OSHA's bloodborne pathogen standards. Immediately make available to exposed worker a confidential medical evaluation and follow up. Document routes of exposure and circumstances of exposure incident. Identify and document source individual. Unless infeasible or prohibited, collect and test blood for hepatitis B and HIV serological status. When medically indicated, U.S. Public Health Service recommends post exposure prophylaxis. Counseling. Evaluation of reported illness. This concludes your training. Please proceed to take the exam.